Welcome to the training video for B-Scan 7000. This advanced bladder scanner offers non-invasive measurement of urinary volume, enabling accurate and efficient monitoring of bladder health. With fast scanning, high precision, and an intuitive interface, it helps reduce unnecessary catheterizations and improves patient comfort. Now, let's walk through how to use the B-Scan 7000. To turn on the device, press the power button on the back and release it when the green light appears. Next, press the top left pad button to wake the screen. Now we should locate the patient's bladder. Firstly, find the patient's anterior superior iliac spine, which can be felt as a bony prominence, and then locate the intersection of the line connecting the anterior superior iliac spine and the body's midline. Apply the ultrasound gel on this point. Before placing the probe, make sure to clean and disinfect the probe with products recommended in the user manual. After done the preparation, tap the scan button on the screen to enter the pre-scan interface. Or press the scan button on the probe to initialize a pre-scan. Select a scanning depth of 160, 180, or 200 millimeters, depending on the thickness of the patient's subcutaneous fat layer. Based on this situation, we will choose 180 millimeters. Place the probe vertically on the spot, with the head of human icon on the probe pointing toward the patient's head. Then you will see the real-time bladder image appear on the screen. Observe the image. If you find that you cannot see the whole image of the bladder, try selecting a deeper scanning depth. Ideally, the bladder should now be visible. If so, make sure it is centered. Gently tilt the probe forward and backward to align the red center line with the center of the bladder's fluid shadow. Meanwhile, observe the bladder contour. When it changes from orange to blue, it indicates that the probe is correctly positioned at the center of the bladder. On the other hand, if you cannot spot bladder's fluid shadow, gently move the probe forward and backward until it becomes visible. If the image is not clear or easy to interpret, check whether there is enough ultrasound gel or apply slightly more pressure to the probe. Once aligned, keep the contact plane between the probe and the patient steady. Next, we need to find the largest cross-sectional view of the bladder. Slowly rotate the probe left and right to capture the largest view of the bladder. Once the image is optimized, it's time to perform the scan. Hold the probe steady and press the scan button, either on the screen or on the probe. During the system calculating, unmove and hold the probe steady. The system will automatically collect 12 cross-sectional images to build a 3D model of the bladder, and then calculate the bladder volume. After calculation, it will enter the scan result interface and display the bladder image along with the volume result. Take a moment to check the result. Check whether the bladder contour is complete. A complete contour should follow the bladder shape clearly and smoothly. If the outline is broken, missing sections, or does not match the bladder shape, it is considered incomplete. Meanwhile, check whether the bladder image falls within the target area. If you notice an incomplete contour, tap and hold the bladder image to refine the outline. Once you've validated the image and volume result, you can either save the report locally or print it using a connected printer. Once you're done, remember to clean the probe and store it in the cart. Thank you for watching this operation tutorial. We hope it helps you use the device with confidence and ease. Feel free to revisit this video anytime you need a refresher.